I'd like to welcome everyone to Minding Your Brain webinar being organized by the Brain and Mind Institute here at Aga Khan University. We're pleased to extend a warm greeting to all participants joining us today, whether in person in Nairobi, Kenya, or virtually from various locations worldwide, including Pakistan, the USA, the UK, Uganda, Tanzania, Australia, Malawi, Nigeria, Canada, and beyond. So you can see we're truly global. Allow me to share some information about the BMI. BMI is an institute which was launched basically to address the rise in mental health and neurological conditions that are now at the top of the list of threats to economic and social well-being of the people and communities that are served by Aga Khan universities. We work in collaboration with several partners to enhance capacity for leadership and influence in addressing neuroscience and mental health issues in East Africa, Pakistan, and South Asia. Allow me to share a little bit about our vision and mission. The vision statement focuses on tomorrow and what the organization wants to become, while the mission statement will focus on today and what the organization does. Our vision basically is healthy brain, healthy world. Our mission is we're advancing brain health through collaborative research, education, innovation in mental health and neuroscience. And our values are impact, quality, relevance, and access. We have 4 pillars, as I mentioned before: research, education, engagement, and innovation, which are so important to all the work that we do. What I'd also like to let you know that we're truly global. If you can see the slide here, Afghanistan, Karachi, United Kingdom, Lisbon, quality. But with that, I'd like to introduce our moderator today, Karen Blackman. Karen has an extensive bio, which of course we couldn't fit on this slide. So this is a very abbreviated version of her bio, and somebody will be posting her full bio in the chat. So please make sure you read it. She's quite accomplished. Dr. Karen Blackman is a consultant neuropsychologist with the Brain and Mind Institute. She has a doctoral degree in clinical psychology at the New School for Social Research in New York City, and a postdoctoral fellowship in clinical neuropsychology at New York University Comprehensive Epilepsy Center. She is also board certified in clinical neuropsychology through the American Board of Professional Psychology. Please allow me to welcome Dr. Karen Blackman. Karen.
Thank you, Dr. Hasham. Thank you to all of the wonderful panelists, and thank you to the attendees. If you're here today, it's because you care about your brain health. And as a neuropsychologist, we basically, the foundation of our job is to work with patients to improve their brain health and to help people live as well as possible, even in the context of chronic neurologic or psychiatric conditions. So I'd like to introduce our panelists one by one, and then we'll move into specific questions for each panelist, and they'll tell us a little bit more about their views of brain health, and then we'll open it up to the audience for general Q&A. So starting with our first panelist, I'd like to introduce Dr. Beverly Chesarum. We're very fortunate to have her today. She's an accomplished neurosurgeon. She's been trained around the world in neurosurgery and advanced techniques. Not only is she skilled in the neurosurgery in the OR, she also demonstrates a commitment to global health and educating all of us about ways to improve our brain health. She holds a position of consultant neurosurgeon and assistant professor at Aga Khan University Hospital in Nairobi, Kenya. So thank you, Dr. Chesarum, for being with us this morning. I know you're very busy and we appreciate your insights.
Thank you.
I'd like to introduce the next panelist. We're also very fortunate to have Professor Saeed Athar Inam, who's a professor of neurosurgery at Aga Khan University. He's US board certified in neurosurgery, a professor of neurosurgery, and director of the Juma Research Laboratory at Aga Khan University in Karachi, Pakistan. He's been awarded several accolades and honors in the US and Pakistan, including Physician of the Year Medallion, the Master Surgeon Award, Excellence in Neurosurgery Award, and the Presidential Award. So we're very fortunate. You can see we have an esteemed panel here today with us. I'd love to introduce the next panelist, Professor Lukoya Atwoli. He's the Deputy Director of the Brain and Mind Institute, and he's the Dean of the Medical College at Aga Khan University. He has extensive leadership, teaching, and academic research experience. He's a visiting scientist at the Harvard T.H. Chan School of Public Health and an honorary associate professor at the Department of Psychiatry and Mental Health in Cape Town. So we have not only a esteemed panel, but a diverse panel of neurosurgeons and psychiatrists. And finally, it's my great pleasure to introduce Professor Zul Marali, who's the founding director of Brain and Mind Institute at Aga Khan University and a neuroscientist and pharmacologist. He's the past president and scientific director, of the University of Ottawa Institute of Mental Health Research. He is a full professor in the faculties of medicine and social sciences and psychology, as well as a research professor at the Institute of Neuroscience at Carleton University. Dr. Marali has published over 100 scientific papers, more than 20 book chapters, and over 100 conference presentations. So we can now feel comfortable in knowing that we are with some of the top professors and neurosurgeons in the world in their craft, and we thank you all for being here with us today. So I'd like to open this session with a question for Professor Inam. How can we identify early warning signs of neurologic disorders, and what are some treatments that are available?
So that's a very, very large question. It takes 5 to 7 years to understand that question, during residency program. So neurologic disorders, because it can be anything from simple strokes to brain tumors to all the psychiatric problems that we are really gathered here in terms of mental health. But I think what we are focusing today is more of on mental health. And mental health is something that affects everyone, whether it's a simple viral infection or it's a neurological disorder such as a brain tumor. So the earliest signs that we start to see, let's say a patient that comes in with a brain tumor, can be very specific signs of brain tumors like seizures and focal neurological deficits. But then the other things that really affect our mental health and the signs that you are probably referring to is more of losing interest, distraction, not ability to focus, inability to plan ahead, those kind of things. So it's not, those are very subtle signs, and it's not easy for a physician to pick them up unless you go through a detailed interview. And for that purpose, we have our esteemed psychiatrists and psychologists to do that. I can tell you that when it comes to a neurosurgeon, we really are not so good in picking up those signs of mental health early on as the psychiatrists and psychologists are. But I think everyone among the attendees, those who are going to be neurologists or are neurologists or neurosurgeons, we need to focus on those things. And I have picked those things up where you see the way the patient interacts with the family members, the lack of interest, the apathy, and all those things. So I don't know. I mean, it's a very, very large answer, but I guess I was able to give some idea of that.
Yes, thank you. Thank you. We also have Professor LaCoy back with us. And so as someone who's regularly talking to patients about their mental health, we're just going to revisit that question. What are some of the most common mental health challenges that people face?
Yeah. So when you think about mental health challenges, and I hope now I'm clear, when you think about mental health challenges, we start with problems that first occur in children. And, there are challenges that you will notice: children who have difficulty socializing, or children who have difficulty grasping things in school, children who have difficulty following instructions. And so those are some of the commonest, earliest signs of, psychological or mental problems. And some of them, cut across neurological problems and mental health problems. So conditions like autistic spectrum disorders, conditions like attention deficit hyperactivity disorder, and so on, are increasing, perhaps because we are becoming better and better at recognizing them, but also perhaps because they are really, really increasing in the current environment that we are in. As we go among adults, we live in a world that has a lot of issues, a lot of things happening, and a huge proportion of our population is exposed to traumatic and potentially traumatic events. So conditions related to trauma exposure are also pretty prevalent in the world. And then sometimes related to that, we have substance use disorders, where people start using substances and then they start using them in ways that harm them physically, psychologically, and socially. And then we have these other conditions, like the mood disorders, prominent among them is depression, which is pretty common. In some estimates, it's been estimated between 15 to 25% of the population suffer significant symptoms, depression. And related to that, then we have anxiety disorders as well, which are pretty common across board. Many of them are unrecognized, and people live with them without seeking help. And then we worry a lot also about suicide and suicidal ideation. And in one of the surveys we did in Western Kenya, we found that 1 out of 8 people in the population had serious suicidal thoughts. And many people had attempted suicide, and this hadn't come to the attention of health providers because they never ended up in hospital. So that is just an overview of the range of psychological and mental problems that we are seeing in the community right now. Thank you.
And are there some ways in which people can address and promote mental health in their daily life? Things, even if they don't have regular daily access to a psychiatric facility where they could get care, are there things that they can do to improve depression and anxiety in their daily lives?
Absolutely. I think if you look at the things that can be done to help with many of these common mental problems, the vast majority of those things can be done by people themselves or by the people they live with without necessarily seeking expert intervention. The first thing that we would advise anyone about their health and their mental health is to be mindful of their physical health. So, being physically active, eating well, getting adequate rest when you need it, and so on. So those are things that we would advise anyone. The human body is not designed to sit the way we sit, most of us. It's designed to be on the move, upright, or when you're tired, to sleep horizontally. So it's unhealthy to sit for long periods of time. It's unhealthy to be sedentary, and that affects your mental functioning as well as the physical functioning. Beyond that, social connectedness is an important aspect of mental health. We think that having a large social support network is not only useful in identifying problems when they are arising, but it's also useful in maintaining good mental health in general. Having people you can speak to, having people you hang out with, having people you play with is an important component of our mental health. The other thing that we find being very helpful is having an attitude of hopeful, having hope, thinking about the future in a positive way, having something you look forward to is also good for your mental health. And something else that we just talk about without really thinking about it is gratefulness. Being grateful for the things we get, being grateful for the things we have, for the people we have around us, is also absolutely important for our mental health. And finally, giving, finding ways of contributing to the community around us. It keeps us connected. It builds our social network, but it also helps people to figure out when you're starting to have problems and for them to channel us to care. So those are just some of the things that I think if we can practice on a day-to-day basis, that helps to keep us mentally healthy and also help prevent some of the mental illnesses and help us to be able to intervene early. There are many others, but we can have those discussions in the course of the working.
Professor Lakoya, we're so grateful for these answers and these responses. As a neuropsychologist, we always like to repeat back the key things for memory to encode this so that you can actually use these tips to change your life. So just to repeat back what you said, you're saying stay physical, move your body, sleep well, eat well, stay socially connected, identify areas of your life where you find purpose and meaning and you're giving back to the community, and stay it sounds like what you're saying, a sense of gratitude in your daily life, and to almost meditate on the things that we are grateful for on a daily basis in ourselves and in our families and in our worlds. So those are really powerful pieces of advice, and I think everyone can benefit from them. Thank you so much. And I'm going to direct the next question to Dr. Chesaram. Dr. Chesram, what are some of the common brain health issues that people face? So we just talked about mental health, and actually they're kind of similar. So you may add on to what Professor Lakoya is telling us. What are some of the common brain health issues that people face, and what can we do to prevent those?
Thank you very much. I think that I'd like to frame my answers using analogies. But the way I try to think of the human brain, I think about it as we're a sensuous being, always getting information from the outside world, giving it meaning, interpreting it, and then making a reaction to it, which is now like the motor function, the ability to choose, smile, etc. So the human brain development, if we could break it down in a couple of phases, there is what you call the in utero, so when you're in the womb. And the factors around that is basically in your mother's womb, you form not only your brain, but you start to make a lot of the major connections and anatomical associations within that brain. And so there are factors that we know about. The first thing is that the brain tends to develop in the first trimester. If you break down the period of pregnancy into the first 3 phases. And the interesting thing is that most women often don't know they're pregnant. So the critical development of the brain can often happen before a woman realizes that she is with child. So it goes back to what Professor Lakoya had said, which is about your general well-being. The context of your life in the environment and the life choices that you make have a profound effect on the baby's mental development and brain development. A case in point, for example, the utilization of folic acid within our diet, which is plentiful in vegetables, but not always the first thing we come to mind when we're thinking about healthy living. And so we need to be purposeful about that. Utilization of toxins, whether or not they're socially acceptable. So, depending on where you live, cigarette smoking, alcohol, etc., may be socially acceptable, but do have an effect on a growing brain. And also illegal substances that may also have an effect on the brain, such as cocaine, etc. Then we also have the category of what you call prescribed medications that may have an effect on a growing brain. So the anti-seizure medications, various cancer drugs, etc. So one needs to be cognizant that if they're planning or to conceive, that they have had a wellness check to ensure that they've had the ultimate environment for the child. The second thing is that we know there's an increasing theory to support what you call maternal health, fetal origins of adult disease, that not only with brain disease, but many other illnesses have their origins in how you're knit in your mother's womb. And a lot of that has to do with the size of the placenta that you get. But the size of your placenta is determined when you were in a mother, when she was in her mother's womb. So we need to take care of, if we want to change the overall health of maternal health, then we need to start about 2 or 3 generations in advance so that we can have optimal uterine conditions for the babies. So the conditions around development, those that we get a congenital disease, and other issues such as spina bifida, etc., in the womb. Then as you go into childhood and later childhood, the issues are around the environment we've created for our children. So diet, yes, is a factor, but trauma becomes quite a big player, particularly in our cultures. We're in Pan and Kenya and around the world. The kind of environments that we build that allow children to cross the road safely, use the home safely, play safely, all those play a major factor in whether their brain, their growing brain, has a realistic chance of fully maturing into adulthood and achieving full capacity. Infection is also very important. We talk about the importance of adhering to immunization, antibiotic therapies that are appropriate, early health-seeking behaviors for these children, because infection is almost like a short circuit to the brain. It causes significant inflammatory conditions. It can cause strokes in certain parts of the brain, and it can cause profound developmental delay, as well as affecting the overall structure and drainage of fluid within the brain. So investment in childhood health, good childhood health in communities is a profound aspect of improving brain health. Then, there's the aging brain. So the aging brain, if you think about it as your library, you're going to take advantage of as many books as you have put in. So the more you invest in early childhood, the more diverse, rich your library is going to be, and the better your reserve is going to be in preserving your function in later age. So diseases that come as we grow older, things like stroke, degeneration, neuroinflammatory, movement disorders, dementia. And all these are, in many ways, I tend to tell people what you become in your 20s and 30s is the investment your parents put into you, who you become in your 70s and 80s is the choices you made for yourself and the environments we generated for ourselves. So I speak very broadly because a neurosurgeon only meets a very small proportion of the overall brain degeneration and challenges. And of course, there are other things that I haven't covered, like tumors, which are often not your fault, but the early presentation, early management, adherence to health improves what we say about our library and its capacity to function at optimum value. So that's a broad range, and I hope we'll have integrated discussion around that.
Thank you. That's such excellent advice. I'm assuming most of the attendees are in their either early or middle, or maybe even late adulthood. And so what you're hearing, or what I'm hearing, is that we should be taking care of our bodies to protect the next generation and also to protect our future. And we should also be pushing policymakers to create safe environments in our communities so that our children and ourselves aren't harmed, and that we're pushing for infection control to reduce exposures to infectious disease that could further complicate our brain health. So these are great pieces of advice for ourselves personally and for our policymakers and community members that can influence policy. So thank you for all of that. I'm going to direct the next question to Professor Zul Murali. Dr. Murali, as a founding director of the Brain and Mind Institute, what role is the Institute playing in promoting healthy brain aging?
It's a big question again. And I think that the main focus for the Brain and Mind Institute has been mental health and brain health. And one of the things that is unique to the Brain and Mind Institute, because it's affiliated with the Aga Khan University, the university has a footprint in many developing countries, and these are usually low to middle income countries, for one, so that the environment of trauma is quite dominant. And then secondly, what's interesting to note is that the populations are fairly young. In other words, the median age in these countries where AKU is around 20 years. That means half the population is under 20 years. So what that means is that we take it as an opportunity to intervene early. So early detection, early intervention are very important to the mitigation strategies that we might want to deploy. The kinds of things that we're doing at the Aga Khan University, at the Brain and Mind Institute, are going into the communities and doing some early screening, early detection, early intervention. And one of the paradigm shifting approach that we're taking is essentially not focusing only on tertiary specialty interventions. Those are critically important, but those are reserved for people who are severely ill and typically very small in numbers. But if you look at the bottom of the pyramid, which is the population that's well, or if you look at people who are at risk or people who are mildly ill, that really encompasses the majority of the people. And I think that the way we want to shift our paradigm of approach is that we need to put a lot more time and energy and resources at the bottom of the pyramid so that we can do early detection, early intervention, and mobilize resources that are more available to us. Because if you look at specialists like Dr. Enam or Dr. Chesaram, those are hard to come by. These are cream of the crop and very few. We're fortunate to have such wonderful people. But if you look at the pool of psychiatrists that are available in these countries, or neurosurgeons, for example, in these countries, very far and few in between. And so we need to kind of combine their expertise and use them more diligently, but really need to mobilize and empower people who are community workers and other health service providers like nurses and psychologists at the bottom of the pyramid to kind of support the people. And so those are the combined approaches that we are taking in terms of promoting and preventing brain health conditions. Just one last thought is that an example of it is that we've recently introduced a technology, we're calling it M-Parishan, that means M-Distress, essentially where we go into the communities and using the tablet, the lady health workers, which are not highly educated, but guided by the tablet questions, they can screen the people and identify those that are in need, mild need, moderate need, or severe needs, and then give them low-level support where they can, and those that are severely ill needs to be referred up higher up to experts. But doing it this way, we've been able to intervene very early at the people's doorsteps and actually help people recognize mental ill health and start intervening very early on so that their brain health is best looked after. And one more thing I just wanted to mention, that in as we discussed earlier, in the area of mental health, we're focused on suicide prevention, depression, anxiety, and substance use. But when it comes to other brain health conditions, where some of our focus at the Brain and Mind Institute is in looking at dementias and Alzheimer's disease, because this is going to be the next pandemic facing our societies, and also epilepsy, which is highly common in the geographies that we are present in. And so those, in a nutshell, are some of the overarching themes where we want to do brain health promotion. Thank you, Karen.
Thank you. Dr. Marley. It just, it really drives home the fascinating work that's being done really in the communities, to listen to people, to identify early signs of neurologic and psychiatric illness, and to design screening measures that are more appropriate to the surrounding community. I love that proactive, preventative approach. And I think we're going to learn a lot from the Brain and Mind Institute about unique factors in communities that can influence people's neurologic brain and mental health. So now the next question is for Professor Inam. This question may seem simple, but I guess it's another big one. Can a broken brain be fixed?
Thank you, Karen. So yes, it's a big question. It depends how broken it is. So, if you have a dead person, you can't revive that person unless you are Jesus Christ or something like that, right? But if you have someone who is in a coma, then you give all the treatment and the patient may start to come back. So yes, it depends how badly it's broken. There are examples where it's a very simple thing. People think that neurosurgeons do complex things. We do much simpler things than the psychiatrists. There's a patient with a tumor that came in, brain tumor, big over here, no deficit, but the patient will just be showing a lot of behavioral disorders. Got an MRI done, a big meningioma. Dr. Beverly Cheshire would have taken it out and within a couple of hours, and the patient did wonderful. So yes, the broken brain was fixed. But then there are examples where you have a severe Alzheimer's dementia. Can you fix that? No, you can't. So it all depends at what stage you're catching it and what kind of disease is there. But for a general population, it's difficult to assess whether it can be fixed or not. So let's leave it to the professionals, the psychiatrists, the psychologists, the neurologists, the neurosurgeons, to decide. And all of us do try our best to see how much we can fix those broken brain. So the answer is yes or no.
I like that. And just as a neuropsychologist would add, sometimes there's ways to work around a broken brain so that it doesn't influence your life. We might have a memory disorder, but yet there's all sorts of ways of working around that. If we start to lose our memory, we can use our phones and write things down. We can set alerts to remind us to take our medications. All sorts of things that we can do to not just fix a broken brain, but work around and still live as well as possible, even in the context of some deficits in our brain.
Absolutely. The brain has a wonderful potential of plasticity, and it. And even those who are not into neurology and psychiatry know about it. The plasticity, that how much we can really fix our own broken brain if we are given the right chance at the right time. There are some things, for example, a stroke in the motor cortex, very difficult to fix. But then right in front of it is the premotor cortex. A stroke over there, you are again devastated with a paralysis, but then within a few weeks to a couple of months, things are coming back because the rest of the brain starts to pick up and fix those things. So yes, a professional can help you do that.
And that brings us back to Professor Lakoya's excellent points about taking care of your mental health and your brain health, that even if you if you have been injured or have had a stroke, that making sure you're sleeping well, exercising, eating well can promote that plasticity, can help your brain recover. So it becomes even more important to take care of yourself if you have had a neurologic insult, so that you can recover and use your brain's natural plasticity to get functions back. So at this point, we're finished with the pre-submitted questions, and we are going to open it up to a Q&A from audience members. So questions that have been submitted, I guess, in the context of this webinar. And Kendi's going to direct us as to some of those questions, how to see them.
What I will just answer to the excellent answer that you typed is the concept of mindfulness. Mindfulness helps to reduce anxiety, helps to reduce some of the severe symptoms of depression and so on. And it is a really simple exercise of being in the present, of appreciating your environment, both external and internal. So that is an additional thing that we can do ourselves, and it's non-invasive, and it is something that anybody can practice, anybody can do. Thanks.
I'm wondering if any of the panelists could speak to new advances in neuromodulation in brain plants to improve mental health. I had wondered, Dr. Chesaram, are there any things, is there any work being done in that area now in Nairobi?
So at the moment, not yet. So this is within the sphere of functional neurosurgery. And in terms of, here we're talking about mood disorders. There are certain conditions that are linked to mood disorders. So for example, Parkinson's, but also depression itself. In other spheres of the world, there are neuromodulation techniques that include magnetic stimulation, vagal nerve stimulators, which have been thought to improve the overall mood of the patient, and deep brain stimulators in very resistant forms of depression. And a deep brain stimulator effectively is inserting an electrode to a very specific area of the brain, and then alternating the brainwave, the electric signals to moderate. Occasionally, there have been pure lesions that have been inserted in very severe forms of mood disorders, but those are few and far in between. They tend to be a much later treatment. The vast majority, as Professor Lukoye will attest to, the vast majority of patients with early treatment can end up with good functional outcomes. So the earlier one gets specialist help for their condition, the better.
Karen, if I may make a comment on that front, I think Dr. Chesaram is very right. And I think that we are in the process right now to establish a set of labs at the University Center where we will have 2 devices that provide transcranial magnetic stimulation. This is sort of a non-invasive way of stimulating the brain, and it's been shown to be very effective in alleviating symptoms of depression, even just as effective, if not more so, than pharmacotherapy. And it's important research tool, but also therapeutic tool, because it can help us understand what circuits are going awry in the brain so that we can begin to aim treatments better to those circuits. But in essence, I think the RTMS is very important because there are many individuals, for example, many pregnant moms or some individuals that will just refuse to take medications, and you need to have alternate ways of treating their depression. And so this might be one way that we are hoping to address this issue, amongst others.
Thank you. That's just a great response. And also, Dr. Inam, would you like
yes,
to add?
I was just gonna say that, remember what Professor Atwoli mentioned about those basics. So, I'm sure among the attendees, there are some who are much more sophisticated than the panelists over here. But then probably most of the attendees don't have a background of neurology and psychiatry and all that thing. So what we're talking about, electrical stimulation, all that thing, that's just a very, very small, infinitesimally small amount of patients who would be candidates for that. The majority is what Professor Thwoli mentioned, and which you, Dr. Blackman, very eloquently summarized it. those are the things, you just follow that, and 99.9% patients are taken care of like that. That's the way I look at it.
And it's free.
And it's free, absolutely.
We forgot to talk about breathing, slow breathing, which is probably the cheapest treatment you can get.
Yeah, yep.
So this question is, in reference to using alcohol as a way of coping. So as a legal practitioner, why do most of my colleagues cope with drugs such as alcohol? Have you noticed such a pattern, or what can be approached for counseling? What can be done? This sounds like a good question for one of our psychiatrists.
Yeah, thank you. I think the brief answer to this is that yes, many people who have access to substances will tend to use substances when they are in distress. And among those people, there are those that are vulnerable to substance use disorders. And when they start using substances, then they have difficulty stopping. And those start affecting them mentally, and they start affecting them physically, and they start affecting them socially. And it is not only among legal practitioners, it's also among medical practitioners, health workers. It's everywhere where the substances are available, and people tend to use them. And those in distress might sometimes use them as a form of self-medication to try and reduce their distress. And in the process, they worsen their circumstances. How do we help? Sometimes just a brief conversation with a health worker that tells them that your pattern of use is potentially harmful to you. This brief intervention, even when they're going to hospital for a headache or other problems, is helpful. Brief conversation with somebody who is important to them. So a spouse, a brother, a parent saying your pattern of drug use is becoming worrying. That is a useful starting point. But when it gets worse and goes beyond the ability of family and friends to help, then it is time to involve the expert. We have substance use treatment facilities in our areas, people versed in the mental health of substance use. And our very own Samin has been involved in that kind of treatment, and maybe you want to say a couple of things about that.
Thank you, Professor Lukoye, for that. Yes, mental health and substance use are interrelated, and what we're finding is that individuals who use drugs or substances at a very young age, we see change in their brain function. And this then affects their healthy aging, and we see the effects, in the long term. So the longer they use drugs, and of course the amount that they use certainly affects mental health and cognition, and in the later years as well. But I completely agree with you, Professor Lukoye. Exactly what you said is very relevant, and that's what we're seeing on the ground as well. Thank you.
Great, and I would only add to that every year of sobriety can improve your health, and that even if someone has been using alcohol for a long time as a coping mechanism, by discontinuing that, replacing it with other healthy coping behaviors, then the brain can recover, use its natural plasticity, and make up for some of those years of alcohol exposure. So now we'll read the next question. This, there's no specific panelist that's been addressed, but the general question is about post-COVID symptoms, specifically memory lapse. We do know, we've heard a lot in the press about people struggling with memory problems, difficulty focusing, difficulty doing their jobs after COVID, that they find it hard to stick to their to-do list, that they feel more tired. When they exert themselves, they might feel the brunt of that the next day, where they might be more tired. We call that post-exertional malaise or fatigue. So the question is this true? And are they going to continue to fade, the memories? I will speak to that directly, having collected now over 300 neuropsychological test batteries on people after COVID, both 1 month and 6 months later. There are different responses. People who were hospitalized with COVID, who had more severe disease and had to be put on supplementary oxygen, did show some memory problems after COVID, after hospitalization, and that may very, very well be the case with most people who have severe disease, but they tended to recover most functions after 6 months. we found that people who were not hospitalized, who had more mild disease, did struggle with some attentional problems, some processing speed slowing, but they also tended to recover after 6 months. So it comes back to those basic lifestyle factors of getting your rest, drinking water, breathing every day, nice and slowly. To breath work is a big therapy after COVID to increase your lung capacity gently, getting back into exercise at a paced level, gradually pacing your exercise to return. So, but the big problem is getting stuck in a sedentary lifestyle, getting stuck in the sick mindset and not being able to move forward. So we try to promote almost a relentless return to health, gradual and gentle, but still always with the idea that you will get your health back eventually. Okay, Dr. Atwole?
Yeah, if I may just add, other than the direct physical effects of the virus on the nervous system that causes some of those symptoms, the COVID-19 pandemic was a global, potentially traumatic event, if you like. And people exposed to traumatic events sometimes also tend to suffer from memory problems, because at the time you're being exposed to it, it is such a shocker that your brain is not necessarily properly recording events that are happening around that time. And that might explain some of the memory loss, not all of it, in that context. And we are still studying this phenomenon, and we'll probably understand it better with time as we collect more data.
Thank you. That's a really good point. And someone in the audience asked about other viral infections, infectious disease like dengue. And we do know that anytime the body launches a strong inflammatory response, because that's what the body's meant to do, it sends out its defenders, it has an inflammatory response that sometimes that can be so strong and it can be so lasting that we get this brain fog and we get the sense of fatigue. But our bodies are meant to heal. So we have to let them do what they're supposed to do. Anti-inflammatory diets can help. So eating what we put in our bodies can help to modulate some of that chronic inflammatory response. But in general, I think it's really important, the points that Dr. Atwole's made as well, to attend to the mental health burden and the trauma that has surrounded COVID, and to basically do anything we would normally do to treat depression, anxiety, and trauma is also relevant for COVID. So moving on to the next question, what are some of the ways we can maintain a healthy dopamine system in a world filled with too much pleasurable stimuli all over the place? This is a great, great question. I'm curious to hear the response myself.
Oh, I'll give it a try. It's a very hard question, as you will realize. So the world is full of stimuli. The judgment about whether they're pleasurable or not pleasurable sometimes comes down to the individual experiencing those stimuli. The world has always been full of stimuli. That's how our brains develop. That's how we understand our environment. That's how we interact with the environment. And then based on our own internal makeup, we make a call as to whether this is pleasurable and I want to experience it again, or whether it is not pleasurable and I don't want to ever experience it again. So those will always be there. Self-care involves deciding at some level what kind of stimuli you will expose yourself to, what kind of stimuli you'll allow yourself to continuously experience. If you go back to the basics, the human body needs a period of activity and it needs a period of rest. Then no matter how pleasurable or noxious the stimuli are, you will be exposed to them for a period of time, but you will need to take a break and you will need to rest. Doing things on your computer, working on your tablet, and so on. It's okay to do that for a period of time. Going on social media and getting the dopamine rush when you see people liking the things you have posted, that's all fine, but only for a period of time. You still need to take a break and you need to rest from that. Your brain needs that in order for it to continue functioning. I see Zul wants to add something to that. Right?
Yeah, no, you're absolutely right, Lukoy. And I think what is interesting about dopamine is that there's a bit of a misconception about dopamine, because dopamine goes up when you have pleasurable events. In some circuits within the brain, dopamine is activated for sure. But by the same token, when you are exposed to stressors, the dopamine levels also go up in the brain. And like, again, it's a bit circuit dependent where in the brain you're looking at dopamine activity. So I think that the dopamine would go up, whether it's a positively reinforcing event or a negatively reinforcing event. And in essence, I think that it's a bit simplistic to think that just by modulating the dopamine levels that you would be able to modulate your brain sense of well-being. I think that it's much more complex. And the other thing is that dopamine hardly ever functions on its own. Like, there are so many different transmitters within the brain, they interact with each other. And so it's more meaningful to look at a combination of factors, neurochemical activities that go on in the brain. Just like we at one point in time used to ascribe serotonin as primarily involved in depression, and now we're learning that that's not necessarily all true. It depends on where and when that we need to kind of pay attention to. But it's an interesting concept. Thank you.
Yes, and Dr. Chesser, I saw that you had your hand up. I'd love to hear your additions to that.
So I support what they both said. I think the challenge in today's world is the perceived inability to switch off. Because before we had electricity, that we didn't have a choice. It was daytime and then it was nighttime, and we all shut down and we went back to the village and we went to bed. But with electricity and then the internet and pressures of work and the ability of, we call it FOMO, or fear of missing out, then we can end up putting ourselves in a perpetual treadmill that doesn't allow our body to function in a healthy way for itself and also for the social context. I think that also the other thing that some of these stimulations are an indicator to us of what I would term social isolation in a crowd. In other words, in the absence of strong social bonds, we find ourselves going online for the same. And creating this types of relationships that lack some elements. I would say they're two-dimensional. They lack the depth that comes with having to deal with somebody in your environment, both the positive and the negative aspects of that relationship. So when somebody's talking about use of social media, etc., I think we go back to the idea we're talking about mindfulness and asking ourselves hard questions about what are my trigger factors for having to constantly utilize these various stimuli, and how can I mitigate against it through perhaps better structures and utilizing your social network as an alternative.
These are excellent pieces of advice. And we are now starting to near the end of this webinar. So I'd love to have every panelist just give us some closing advice to go out in the world with a health mindset to take care of our brains and our bodies. So starting with Dr. Murali, any closing pieces of advice for our attendees?
The one permeating factor that goes across a lot of the discussions that we have had so far deals with this idea of the brain and its function. In essence, brain is highly sensory. Its entire purpose is to actually monitor the environment, being psychological environment, stressful environment, whatever, chemical environment, whatever is going on. The brain is a sensory organ that actually responds to it. So the boundary between the brain and the environment is not as rigid as we would like to believe. A brain is influenced very much by the environment. And there are two aspects to it. One is that it is a positive thing, because if we know that we can modulate brain function by actually determining what kind of exposures you get from the environment, then you can take many protective measures for brain health. We were discussing those earlier. I won't go into them again. But the fact is that if you look at the logo of the Brain and Mind Institute, you will see that there's a little leaf embedded in the brain, and that talks to this neuroplasticity and responsiveness to the environment. And so it's important that we realize that the environment and the brain are not as separated as we would like to believe, and hence a lot of our interventions and treatments are now very often based on sensory input that comes to the brain, and we can modulate there sometimes quite cheaply and readily. So I'll stop at that. It's a message of hope.
Thank you. We like that. And Dr. Inam?
Well, first of all, I mean, all those points that Professor Atwoli, those are basics. You can't forget the basics, fundamentals. But I would like to relate it to my personal experience. And, I went through all the education and training and built up a practice, and this hotshot neurosurgeon, not as hotshot as Beverly is, but, this hotshot neurosurgeon built a house and everything. And then I went through depression because I had achieved all my goals. So that's when I learned. This is about 14 years ago. That's when I learned, and that's what I've been telling to my kids and to my residents, that the day you die, if you have a lot of unfinished agendas, you're a lucky person. So my key to keeping happy and healthy brain is that I have a struggle in front of me. Agendas the unfinished agendas. The day I take care of all those agendas, I will go down. I'll get depressed. So that's my key.
Thank you, Arthur, for sharing that. I think that's very brave of you. And really, it's so important that people realize that these mental health conditions are so common. 1 in 3, 1 in 4 of us will have depression or anxiety disorders in their lifetime, and we don't talk about it. So thank you for bringing it to surface.
Yes, and I love this message of recovery, that you can get through very hard things and get insights, and we all are very resilient, and we can come through things that are difficult, but we end up stronger. So I think these messages are just priceless. So I'd love to hear some closing words from Dr. Chesaram as well.
Thank you so much. It's been a pleasure to be with master surgeons who are very complimentary. I think that what I would like the audience to know is that the care of the brain is a team effort. We are just but a small representation of those who make it their business to work around brain health, mental health. And a very important part of why we do this is that a huge part is the environment that we exist in and in the society that we exist in. So feel free to get the help that you need, and know that our specialists work in together. So we would refer to each other, we would assist you with the care that you need, and also that many of these conditions, if treated well, significantly improve your quality of life, your ability to work, and to have good relationships. So thank you.
Thank you, Dr. Chesaram. And closing words from Dr. Atwoli.
Thank you very much. I will pick up from where Zul left off. But so the brain is sitting here, and there is environment and stimuli that come in, and the brain makes sense of those and gives feedback so that we do something about the environment. And in there, we acquire or develop an awareness of all these things happening. And that is a space in which the mind sits. And so you can see the mind occupying a space within your body and outside of your body as you interact with the environment, developing boundaries of being, boundaries of where you start and where you end. For instance, in many African societies, you don't end. You are because of the people around you. You're part of the people around you, they're part of you. And then there are other traditions where it's very specifically defined to end within the body. So every single thing you do, every stimulus you're exposed to, every response you give goes to affect how your mind functions. And so it is important to be very intentional about the things that we do to ourselves and do to others and do to our environment if we are going to have good mental health. Thank you very much.
Well, I feel very lucky to have my community this morning be all of you, and your incredible lived experiences and wisdom. And I'd love to just finish off by thanking Dr. Hisham as well, and just checking in to see if there are any closing comments from you. And I'd love to hear from you as well to close the session.
Thank you, Dr. Blackmon. Thank you so much. You were an amazing moderator. Thank you for leading this very important and timely discussion. Thank you so much. Thank you also to Dr. Machungi for helping facilitate this session. Thank you so much. Secondly, I'd like to appreciate all the panelists for honoring our invitation, but also for their brilliant, thought-provoking conversations and sharing their insights and tips on how to maintain a healthy brain. We talked about strategies for improving mental health, enhancing cognitive function, reducing stress, all the way from pre-birth to healthy aging. Movement is medicine, as they say, and dopamine is medicine too. And I really like that we talked about epigenetics and neuroplasticity, because these are becoming so relevant, as is resiliency, which is possible. And I think we all appreciated that relationship between a healthy brain and a healthy world is becoming even more relevant in this complex world. But most importantly, I'd like to thank all the participants. I think we had over 120 or 30 at last count, all the participants. Without your attendance and input, this webinar would not have been a success. So thank you again. And I hope to see you in one of our future sessions. Please check out our website for more information and the logo that Zul spoke about, and our 4 pillars as well. Thank you.